You know that feeling, right? When a storm seems to be brewing, inside your own knees. It's that familiar deep ache that feels like it can predict the weather better than any app on your phone. It's a story we've all heard, maybe from our grandparents, but is there any real science behind it? Well, let's get into it and see what's really going on. So here's the big question. Can your body actually act like a human barometer? You might be surprised to hear that the old saying about feeling a storm in your bones, well, it's not just an old wives' tale. The connection is absolutely real, and the science behind it is pretty fascinating. And we're not just talking about a minor twinge here. Get this. During a recent cold snap in Lucknow, India, hospitals saw a 30% surge in patients coming in with joint and bone pain. A 30% jump. That is not a coincidence. It's a widespread, real, physiological response to the environment changing around us. It's basically your body talking to you.
So what's the number one culprit behind all this? It's something you can't see, you can't touch, but it is pressing down on all of us, all the time. It's atmospheric pressure, or as scientists call it, barometric pressure.
Okay, so what is that exactly? Simply put, barometric pressure is just the weight of the air in the atmosphere pushing down on our bodies. I want you to imagine you're at the bottom of a huge ocean of air. That constant pressure actually helps keep our bodies, including all our tissues, in a nice state of balance. Now, get ready for this, because the sheer scale of that pressure is kind of mind-blowing. On average, the atmosphere is pushing on us with about 14.7 pounds of force for every single square inch of our bodies. Crazy, right? Our bodies are just so used to it that we don't even feel it. But trust me, it plays a huge role in how our joints feel. And here's the key. This is where it all clicks. Right before bad weather rolls in, like a rainstorm or a cold front, the weight of that atmosphere actually gets lighter. That drop in barometric pressure is the very first signal your body gets that the weather's about to turn. So, what happens inside your body? Well, with less air pressure pushing from the outside, your internal tissues, we're talking muscles, tendons, all that stuff, they can actually expand just a tiny bit. Think of it like a sponge that's been squeezed tight and is suddenly released. It puffs up.
So why does this hurt some people and not others? It's all about space. In a healthy joint, there's plenty of room to handle that minor tissue expansion. No big deal. But in a joint that's already dealing with arthritis, where space is tight because of inflammation and cartilage loss, that same little expansion pushes on sensitive nerve endings. And that's what triggers the pain.
But you know what? It's not just about pressure. The temperature itself plays a massive role in that stiff, achy feeling. There's a reason we call it bone-chilling cold, right? Okay, so inside our joints, we have this amazing stuff called synovial fluid. You can think of it like motor oil for your body. Its main job is to lubricate everything, keeping our joints moving smoothly and without any friction. I absolutely love this quote from Dr. Andrew Bang because it paints such a perfect picture. It can get sludgy. Just like motor oil gets thicker and goopier in the cold, your synovial fluid does the same thing when the temperature drops. And that sludgy fluid just isn't very good at its job, which leads to that classic feeling of stiffness. This all kicks off a little chain reaction. As it gets colder, your body does something smart. It constricts the blood vessels in your arms and legs to keep your core warm and protect your vital organs. But that also means less circulation. And when you combine that with the thicker joint fluid, well, you've got a perfect storm for stiffness and pain. Okay, so we've covered how this all happens. But now let's talk about who is most likely to feel these changes. And it's not just about getting older. It's really about the history that's written on our bodies. The numbers on this are really clear, and they might just validate what you've been feeling for years. In one big study, almost 70%, that's nearly 7 out of 10 people with osteoarthritis said their pain was directly sensitive to the weather. So no, it is not just in your head. So who feels it the most? Well, the most sensitive groups tend to be people with chronic conditions, like osteoarthritis and rheumatoid arthritis. But it also includes people with fibromyalgia, and this is a big one, anyone with old injuries or who has had surgery in the past. And have you ever wondered why that old football injury from high school acts up? It's because scar tissue is way denser and less flexible than your normal, healthy tissue. So when the barometric pressure drops and your other tissues try to expand, that stiff scar tissue just doesn't want to give. It creates a conflict in there that your nerves register as pain. And hey, this isn't just an issue for older folks or former athletes. We're actually seeing a rise in something called technic winter. Think about it. A lot of us already have bad posture from looking down at our phones and screens all day, but that gets so much worse in the cold when we instinctively hunch over and huddle up for warmth.
That leads to some really painful muscle spasms in the neck and shoulders.
All right, so we get the science now. But here's the best part. We are not helpless against the forecast. There are simple, really effective things we can do to manage this pain and keep ourselves moving. If you remember one single thing from all this, please let it be this. Motion is lotion. I know, it feels like the last thing you want to do when you're stiff and sore. But regular, gentle movement is exactly what circulates that synovial fluid, lubricating your joints and making the muscles that support them stronger. Your diet is another really powerful tool in your arsenal. Foods that are rich in omega-3s, like fatty fish, antioxidants from berries, and powerful compounds in things like broccoli, turmeric, and ginger, they can all help manage the underlying inflammation that makes your joints so sensitive to begin with. So, let's put together your winter toolkit. The key strategies are actually pretty simple but super effective. First, dress in layers to stay warm. Use heat therapy, like a warm shower in the morning or a heating pad to loosen things up. And finally, make sure you're incorporating regular, gentle stretching to maintain your flexibility.
Look, at the end of the day, we can't change the barometric pressure, we can't stop a cold front from rolling in, but what the science shows us is that we are completely in control of how our bodies respond to it. The weather does not have to dictate how you feel. So my question for you is, what's one small change from this toolkit that you can use to take back control starting today?